All right, so in the first part of this lecture, we talked about these three helping conundrums, right, or these difficult situations that policymakers and analysts encounter when attempting to address the issue of poverty through our policies. And so just keep those in mind as we move through the actual discussion of the actual history of social welfare policy in the US. And to do that, we have to go all the way back to Great Britain, England back in the 14th and 15th centuries. The US system borrows from the British system, and so we trace our roots really to the British system in the 14th and 15th centuries. And the very first recorded method of addressing poverty at this time is simply through mutual aid. So if you fall on hard times, it's really up to your neighbor. It's really a private system. In other words, it's up to your neighbor. It's up to maybe any churches that are willing to provide assistance. Or maybe a wealthy landowner may find it in their spirit to assist the poor. That's a system that's largely in place during this time. And you can imagine what the economic system is that we have in the 14th, 15th century. It's largely farm-based. Most people are farmers. But even so, a society can still become more and more complex, right? You have advances in the farming technology, and that's what's occurring during this time, during the 14th, 15th centuries. But at the same time, you may have some climatic disasters that render it that maybe farmers fall on hard times and such. And so, really, the very first laws that were put in place to address persons who may be experiencing economic hardship was the statute of laborers. That was intended to help poor farmers and other laborers to get through those difficult times. So we have those laws in place in the 14th and 15th centuries. We're moving into the 16th century, and the economy is changing. We have really the first recorded wave of industrialization, where we're moving away from that farm-based economy. We're starting to move away from that feudal system, in other words, to one that's more industry-based. And specifically in Great Britain at this time, it's really revolving around the wool industry, and later on it would revolve around the coal industry. But of course, with industrialization, there's lots of different social phenomena that often accompany industrialization. And when society becomes that much more complex socially, you have a lot of different social ills that arise, and government takes a more active role in addressing those social ills, which brings us to the British Poor Laws of 1601. So with that wave, that first massive wave of industrialization, industrialization brings with it things like urbanization. If there are jobs that are arising in the inner cities, then people are going to flock to those jobs, of course. And where people flock into the inner cities, you have crowding. Where you have crowding, you have unemployment. With unemployment, you have poverty. And so it's sort of this cycle, right? You have the cycle of social ills that arise. And so the British Poor Laws, we have government involvement, right? The government has taken a more active role in trying to address or control these social ills that are starting to rise in the inner cities. The British Poor Laws, we're taking a look here at some of the main characteristics or provisions of that legislation. And so the law distinguishes between deserving and undeserving poor. And so if you have some inkling in your mind about who might be deserving or undeserving, it's probably not different from what the law was back then. So you have, for example, the aged, the blind, the disabled, the orphan, the widowed, who are classified as being deserving poor under that legislation, so not really much different probably from how you think today. And then there are the vagrants and drunkards, or what we might consider persons who are homeless, or persons with alcohol addiction or other drug addiction. So those classes of persons would be considered undeserving back then, probably undeserving in some people's minds today. And of course, we have different forms of assistance or relief to the different classes of the poor. So very rarely at this time are we providing outdoor relief. Excuse me, and that's by outdoor relief. These are sort of antiquated terms that, that are included in this legislation. But outdoor relief meaning community-based relief, right? Providing assistance to people in their own communities. Very rarely do we have outdoor relief during this time. Most of the relief that we're providing at this time is indoor in nature, and indoor meaning institutionalized relief. So with the poor during that time, we used to put them into almshouses, the poor into almshouses or workhouses, depending on whether you're deserving or undeserving. We would send the deserving poor into almshouses where they would receive alms, or they would have their basic needs met, providing food and assistance and shelter and such. And where they were able to work, they were sent to poorhouses or the workhouses. In other words, these were sort of the origins of our modern day prison system. In other words, you have other features of this legislation. You have residency requirements, not unlike what we have today. For many of our social welfare policies and programs, we certainly have some sort of residency requirement. You have to be a lawful permanent resident at least for 5 years for many of our programs. So not unlike what we have today. And then a note here that programs during this time are administered at the local level. So we have local government units in England at this time. These are parishes, called parishes, and they're administering assistance to the poor. This is Benjamin Franklin in 1766. There's a huge quote here. Just bear with me here through this quote. But Benjamin Franklin is noting in 1766 his concerns with adopting a system that might be that's modeled on the British Poor Laws. He's raising some concerns here in this quote, and so he says, "The day that you passed that act," referring to the British Poor Laws, of course, "you took away from the people's eyes the greatest inducement, the greatest of all inducements to industry, to frugality and sobriety." Right. So essentially, he's saying there that you took away the incentive for people to be industrious, right, to work hard, to be frugal, right, to save, or to be sober for that matter, he knows, and quote, "by giving them a dependence on something else than a careful accumulation during youth and health for support in age and sickness," right? And so he's raising this issue of dependency, right? You're rendering people dependent on the government, in other words. And of course, the assumption here is that we really should be saving for the rainy day, right? When we're healthy, that's when we should be saving. For when we get old is the suggestion here. He says, "I think the best way of doing good for the poor is not making them easy in poverty." So don't make it easy for the poor, he says. There's no country in the world, referring to the U.S. at the time, there's no country in the world where so many provisions are established for the poor, so many almshouses for the aged. In short, you offer a premium for the encouragement of idleness. Basically, you're encouraging laziness, he says. And then the last part, "and you should now wonder that it has its effect in the increase in poverty." And so you shouldn't wonder that the generosity of the system itself basically has the effect of increasing poverty, right, through encouraging laziness. So I think pretty clear in terms of where Benjamin Franklin stands in terms of government involvement in providing assistance to the poor. So you can think about some of the conundrums that may have been raised in that little quote there. So the security work certainly targeting isolation, maybe something about some insinuation about changes in family structure noted in that quote, just in that single quote itself. And speaking of the U.S. system, you'll note that the early system, we're now into the late 1700s, 18th century, in other words, late 18th century. And so the British Poor Laws were adopting some of the same principles. Those principles that we just noted in the British Poor Laws are being carried over into the U.S. system. So things like the residency requirements, distinguishing between different forms of relief for the poor, and we can add a different method. The U.S. method back then was auctioning off the poor during that era. And so this is the system that we have. We're into the 18th century by this time. This is where we take just a little bit of a detour, and we're looking at the origins of, this isn't policy per se, this is the history of the social work profession, and we can thank three major movements that arose in the late 19th century, so we're into the 1800s, late 1800s, 1870s, 1880s, into the early 1900s, and one of those movements is called the child saving movement, and this is initiated by a man named Charles Loring Brace. And so his major societal concern is that of child poverty. Child poverty, as he sees it, is one of the greatest social ills during that time, where he's living in New York City and he's realizing that this is a major social issue that needs to be addressed. And so he founded this organization called the Children's Aid Society, and he has this philosophy about addressing child poverty. And his method of addressing child poverty is to put these are kids who were poor at the time. He puts them on what are called orphan trains. He sends them out to the Midwest, where they're eventually auctioned off to Christian families, where presumably they would learn good Christian morals and become productive citizens of society, because Of course, the assumption there is that much of poverty is learned or passed down from one generation to the next. And so this is his method of addressing child poverty at the time. And so our modern foster care system and our child protective system really has its roots in this child saving movement that was initiated by Charles Loring Brace. Another major movement during this era is the charity organization societies, and they have a certain idea about poverty. We're not just talking about child poverty at this point. We're thinking about poverty in general, and so they think that poverty is largely rooted in individuals and in people's character, right? So their major concern is about individual reform. How do we change people to make them more productive and to get them out of poverty? And so they're going to try to address child poverty, or not child poverty, but poverty, generally speaking, through a method called scientific charity. Right? You've all heard of the scientific method. It's basically the idea that we're going to apply the scientific method to address poverty, and so you can imagine what that entails. We're going to try to come up with some sort of issue that each person has as a challenge, and we're going to offer some hypotheses, some diagnoses about what's wrong with that person. It's sort of a deficit model in that sense. And then we're going to work with the person individually, because poverty is rooted in the individual. We're going to work with that person, try to change that person over time. This is the method that the COS workers have in mind in terms of addressing poverty, right? So if you're interested in casework or clinical social work, you can thank the COS workers and Mary Richmond in particular, who was spearheading this movement through. I should note that there's also a textbook that Mary Richmond wrote, one of the very first sort of clinical textbooks written for social workers, called Social Diagnosis. And we have another major movement during this time, and that's the settlement house movement, spearheaded by Jane Addams. And this group has a different view of poverty. They think poverty is not necessarily rooted in individuals, but they think poverty is more of a structural or more of a macro phenomenon. And so naturally, with that assumption, you're going to have different solutions to addressing the social ill in question. And so they establish what are called settlement houses in target areas. They're going to identify these poverty-stricken neighborhoods. They think poverty is rooted in structural or often neighborhood factors. They're going to establish settlement houses and sort of be the case managers, so to speak, of that era. And so they're going to think about sort of advocacy methods, policy reforms, things like establishing preschools in those neighborhoods, or immigration reforms. The juvenile justice system, they're instrumental in establishing the juvenile justice system here in Illinois. So all the different sort of structural ways to address poverty is their main concern. So you can thank the settlement house workers if you're interested in more macro type social work. It really has its roots in their early thinking about the issue of poverty, certainly. We move to the more modern era. The more modern era in the U.S., we're thinking, now we're looking at industrialization in the U.S. We saw rapid changes in the economy in Great Britain throughout the 14th, 15th, into the 16th and 17th centuries. And we're seeing rapid industrialization, modern industrialization in the U.S. in the late 19th century, and all the different things that we talked about before in terms of the social ills that may arise in response to rapid industrialization. And so at this time, we have the very first inklings of government involvement in the US, not at the federal level, but at the turn of the century, it was mostly incumbent upon state governments to address things like child poverty, or maybe widowhood, or maybe providing pensions to the elderly and disabled. That was mostly at the state level that we did so through the turn of the century. So state governments are becoming much more active during this time. We have mother's aid, mother's pension laws, and old age pensions that are being administered at the state level at this time. And so we're now into the early 1900s, into the 1910s, and we call this era, generally speaking, we call it the progressive era. We call it the progressive era for a reason. There's lots of different social movements. This is an era that's characterized by major social movements. The women's movement takes shape during this time. Women attain the right to vote. There are lots of major workers' reforms, so labor reforms, we don't actually have a federal minimum wage or maybe legislation pertaining to hours worked per week. This is all occurring at the state level. So we have workers' compensation laws. We have child rights, right? Child rights are coming to the forefront. So we have the formation of the Federal Children's Bureau. So some movement, we're starting to see some movement at the federal level as well in terms of children's rights. So a major progressive era with lots of different reforms in this time period. And so that brings us to sort of a dark period in our history, and this is the Great Depression era. We have the stock market crash in 1929 and a severe economic crisis that follows the stock market crash. This is 1929 into the early 1930s. And if you thought that the Great Recession was bad, just you know where that term came from. It's not a modern term. The Great Recession is just a play on words of the Great Depression era. So during the Great Depression era, we may have seen unemployment rates maybe 11%, 12% at its peak during the Great Recession through 2009. But during the Great Depression era, you're talking about unemployment rates that reach close to 25%. 1 in 4 people living in poverty, 1 in 6 people receiving state welfare, right? So we have state governments offering welfare assistance during this time. 1 in 6 receiving welfare. There's some, we didn't start measuring poverty until the 1960s, but some retroactive estimates of poverty, upwards of 70% during this time. So you guys, I think, get the point. There's a very severe, extreme economic crisis during this time, right? Take the Great Recession, multiplied by 2 or 3, and that's what we're dealing with during this time. And so we have a president who comes into office, Franklin Delano Roosevelt, who promulgates or announces this different philosophy about the role of federal government, right? So you'll notice that up until this point, most of the societal ills that we see, things like poverty and unemployment and such, are being addressed at the state level. This is the very first time that historians will note, that policy historians will note, that we have federal government involvement on a massive scale, right? That's really the distinguishing feature of the New Deal philosophy, is that we're not really sort of emphasizing this idea of rugged individualism as much, right? We know that there's so many people who are falling on hard times. It surely can't be the fault of all those individuals. There must be something structural going on. And so we have federal government involvement on a massive scale for the first time, is what we refer to as the New Deal philosophy. And so, which brings us to the Social Security Act of 1935. And this is really the cornerstone. This is just one piece of legislation among lots of different legislation that was passed during this era, but really the cornerstone of what we study in this class. So all the programs, we'll take a look at the structure of the legislation itself in a second here. But like I was noting, this is a novel idea, the idea that the federal government should get involved in regulating the general health, safety, and welfare of the citizenry. And so you have not only the Social Security Act, but you have the Works Progress Administration, you have the Civilian Conservation Corps. These are entities, government entities, that are established specifically to address the issue of unemployment and in providing government jobs. These are essentially federal government jobs that are being provided to all the workers that have been displaced as a result of the economic crisis. And so that brings us to the Social Security Act itself. This is the major piece of legislation. Take a look at Title I. This is old age assistance. Right? This is old age assistance, which Title I is now Title 16. We'll take a look at some of the changes here. But Title I, we have a public assistance program, essentially, that's provided assistance to the old age population. Title II, old age insurance, that's of course Social Security. Title III, unemployment insurance. We still have unemployment insurance. It's still Title III. Title IV, aid to dependent children. That's our welfare system, what's now today called TANF, or Temporary Assistance for Needy Families. Title V is really getting at our foster care system, right? Child support, foster care, that's really just tied into Title IV today. And then we have some other programs. There's a lot of restructuring in these later titles as of today. Right? And so, and so this next section, we'll take a look at sort of the basic structure that comes out of this legislation. You'll notice that there's some assistance programs, there are some insurance programs. So in the next part of this lecture, we'll distinguish between social insurance and public assistance, what those programs typically and generally entail.